Good morning, commissioners and visitors, and I thank you for the opportunity to speak. I'm here today because families in our community are falling through the cracks and will continue to do so as Medicaid funding is cut and fails to meet the growing need. Too many of our neighbors are left without access to the care they deserve. Prior to the Affordable Care Act, many residents in our community couldn't afford health care. I was privileged to donate my time and skills as a nurse alongside other nurses and doctors to develop and work in a free clinic. It was an exceptional experience for both staff and clients. We saw firsthand how a little care and compassion could change lives. And once the ACA became law and more people became eligible for Medicaid, our services weren't needed in the same way. That was progress. But now we're approaching a time when these services will be needed again. We know the stories. Parents skipping prescriptions to buy groceries, veterans navigating trauma without mental health support, and seniors putting off doctor's visits because the cost is just too high. These aren't headlines from somewhere else. They're happening here, and they demand a local response. While we can't control federal decisions, we can choose how we show up locally. According to data issued by the governor, more than 18,000 people in the 14th Congressional District will lose Medicaid coverage. You as commissioners have the power to fund the services that should close these gaps. Behavioral health care, substance use treatments, mobile clinics, and crisis care. This isn't just the right thing to do, it's fiscally smart. Preventative, community-based care saves lives and resources. Not providing health care to uninsured people will overload emergency rooms. I've seen it happen. People with colds, with earaches, with rashes, overload the emergency rooms. These are not paid, these people are not paying for services, but they are never turned away. Therefore, providing some sort of a free clinic would provide the services these people need. So I ask you, will you say enough? Enough to letting health care slip further out of the reach. You can lead by choosing people over politics. You can say enough by funding care and setting up a free clinic right here, right now. I would recommend getting in touch now before the need is there. Getting in touch with the healthcare facilities in our location, getting in touch with churches, and anyone that might have space that could provide, is that me? Provide free space for us. Again, thank you for your time and for your leadership. I made it.
Good morning. My name's Eddie Confer. I live in Latrobe. I'm a member of the Democratic Women of Westmoreland. What I have to say may change a little bit, and you'll see why in a second. There's so many sad and horrible happenings going on in our country. It's kind of hard to focus. But on a local level, and I wrote this before I knew that Carlotta was being recognized, I was deeply affected to learn that Carlotta had retired and that the Diversity Coalition would be closing on June 30th. Carlotta founded the coalition in 2015, as you said, but she also launched the Unity Rally in 1987 after the Ku Klux Klan came through Westmoreland County. It is surreal to recognize that we are once again facing the specter of masked persons with no IDs capturing people to be locked in cages that our president has dubbed Alligator Alcatraz while laughing. I have lived in Westmoreland County all my life. I've attended workshops, forums, discussions about the limited diversity in our county. Our county is over 90% white. Much is said, but nothing gets done. When the opportunity for action is presented, it is ignored. Commissioners every month At these meetings, you offer proclamations recognizing the work of organizations and individuals. I love this. I applaud all those who are recognized. I have learned so much about the good work being done in our county by various individuals and groups. Here are some suggestions for future proclamations. Proclaim June as Pride Month in our county. This was suggested this past June, but fell on deaf ears. Offer proclamations recognizing the work of the NAACP, PFLAG, parents, families, friends of lesbian and gays, the Westmoreland LGBTQ Interfaith Network, and Westmoreland Reads. This program was begun 4 years ago by Dr. Sheila Confer, along with a committee she put together. Again, it's been 4 years. It encourages residents of our county to read and discuss a common book, fostering community engagement and intellectual discussions, often focusing on marginalized groups in our society and our county. I encourage our commissioners to vigorously support these groups, to attend their functions, one more sentence, to be outspoken in your support. It will cost you some white cisgender votes, but now, more than ever, it's the right thing to do. Thank you. Thank you.
I can hold, sure. I'm Kathy Dobbin, and I've resided in Westmoreland County for the past 30 years. This morning I'm going to speak on two things I love, Southwestern PA and sharing food. For the past 10 years, I've been a volunteer with the Latrobe Dairy Meals on Wheels program. I've served on the board the past 3 years as a coordinator of the bag lunch donations from the 24 churches and service organizations that give our Meals on Wheels recipients a bag lunch Monday through Friday, every week of the year. Given the recent big bill passed before the July 4th holiday, federal funding reductions are happening to the SNAP program and Medicaid. These cuts have increased my concerns for the food bank and the Meals on Wheels programs in our county. Last summer, for instance, Latrobe Dairy, we get our hot meal from Latrobe Hospital. The price went up 40%. Now we pass that on to our recipients who pay $5 a day currently. They get the bag lunch for free because the churches donate that. And I'm the coordinator for scheduling those churches. And some of the churches with smaller congregants need subsidized from us. We're lucky in Latrobe Dairy, people leave us money, and we have a nest egg. But because of my concerns over the Medicaid cuts affecting Latrobe Hospital, what happens if the dietary staff's cut and they tell us, next week you've got to find a kitchen, start preparing your own meals? In preparing to learn this meeting and learning more about Meals on Wheels, I contacted Monday and Tuesday over half of the Meals on Wheels program. They're listed on the county website. Thank you. That's how I found Latrobe Dairy, through the county website. All of them work a little bit differently. Believe it or not, all of them called me back. They're busy in the morning. They all call me back in the afternoon, which is why I love Southwestern PA. People call you back. Pig Care that serves Trafford and Level Green, they use their money to pay a cook because they get 90% of their food from the food bank. Vandercrift, local caterers donate food. Programs mention restaurants or grocery stores donating or discounting food for them. No one I spoke to, and that was over half of our Meals on Wheels program, collect federal funds, take federal monies because of the age restrictions. There's income limitations you have to check out. It's just too cumbersome. All the programs rely on recipients to pay some portion of the food cost. Murraysville told me they suggest a $3 a day donation from each recipient. They've never run out of money. That's some and how that food's prepared, where it's coming from, and who's paying for it. Thanks a lot.
Good morning, Helen Sittler from Ligonier. There's a common theme here today, I think. Medicare decreases, SNAP decreases. Now that Congress has passed the bill that will make those decreases, I ask that commissioners be aware of and plan ahead for impacts in Westmoreland County. I spoke recently with someone who works at a methadone clinic in Greensburg. She noted there's a second such clinic in Vandergrift, so 2 from her company. The clinics are entirely dependent on Medicaid funds. First, she's terrified about losing her job. Increased unemployment in the county is a real possibility. Even more, she's worried about the 400 clients who use the Greensburg clinic. For the most part, they don't have jobs. Many are homeless. Many are disabled. They don't have transportation. Medicaid covers their transportation to the clinic, and SNAP provides food for them. I'm paraphrasing what she said to me. When they lose their methadone, they get very sick. They don't want to be sick. They're desperate and will turn to crime to keep themselves from being sick. What will this mean to county law enforcement? Also, what would closing of these clinics mean to emergency services? Is the county prepared for increased calls for assistance? Will Independence Health Facilities be able to absorb more services for people who can't pay? And what about food insufficiency? The county has an implementation plan for use of opioid settlement funds. I ask that commissioners look at that plan with new eyes now and begin to assess how cuts to Medicaid and SNAP will affect services. Perhaps, too, you should be in touch with providers like Independence Health about their viability. Westmoreland County needs to be ready when federal abandonments take hold in the next year or so. But planning needs to start now. We can't all of a sudden have a problem that we know is coming and have done nothing about it. Thank you.
Thank you.
There you go. Here, let me.
All right, hi. My name is Abigail Graham-Pardis. I'm from Murraysville, Pennsylvania. I started an organization called WTF Can I Do Westmoreland, and we've been having the rallies out here. So I think we can all agree that government transparency is vital for a functional democracy or republic. The decisions here, unfortunately, remain a mystery at most of these meetings because they are at a very inconvenient time for most of us who work. And they're not live streamed or archived on your website. I know in the past this has been attempted to have some evening meetings, but they weren't well publicized, and we kind of gave up on it very quickly. The cost is negligible to have a camera and put them on so that people can watch them in real time and watch them later. I did email all of you about this. I heard back from one of you, and I really would appreciate if you took some time to think about this and offered some sort of response. I also invited all of you to the next rally, and I really would hope that you would come and see what so many of your constituents are passionate about and willing to take a stand for.
Hi, my name is Sarah Buzzard. I'm a resident of Allegheny Township and I work in Mount Pleasant Borough. I am here today on behalf of the Westmoreland County Libraries, and I wanted to just tell a story about a community that's formed in my library in the last year. We do a story time every week with our children's librarian, and we've had a lot of new moms, and in the last year these moms have formed such a community amongst themselves. They come to story time, they hang out after story time, they come in on Thursdays, They all hang out. They do something together on Fridays. Just this week, they were talking about how much the library has impacted not only for themselves making those connections, but the relationship that their children have formed together. And right now we're in the middle of summer reading, and the county commissioners give us funds to support our summer reading program. So thank you for that. And thanks for the support in the libraries. And remember that we're here and we do good. We do a lot for little cost. So when it's hot outside, go to your local library if you need to cool down. If you need resources, computers, internet, we have all of that. There are 26 libraries in this county, so don't forget about us.
Thank you.
Hi, my name is Taylor Stewart, and I'm a resident of Greensburg. I'm going to tell you a story. In the summer of 2024, there was a young man who lived next to me. He was 27 years old. He was tall, he was lanky, he had a girlfriend. His mental health was struggling, and that is something that I know is of concern to the commissioners, as was mentioned in the July 8th article. There's a lot of problems in Westmoreland County. That young man, over the next few months, he ended up his girlfriend left because of his mental health. He started to visit me frequently. We would talk and sit and talk for hours on end, on one end of the couch and the other. And we talked about the life and that he loved his life and reggae music, and he was this tall white kid, so I thought that was wild. He just really, he loved it, and he loved that I grew tomatoes. And he loved that he told me about how to use salt to make the soil better. And then when his girlfriend left, he came to me more frequently. I was working one night, and he came and he knocked, but one person can't do everything. And what I'm hearing over and over again in this county is that these small agencies are filled with people that are trying to do much with little, as the libraries have just talked about. I think that Westmoreland County deserves more. On July 18th, he came to my home, and I was working, and I didn't have time. And afterwards, I was exhausted emotionally, and I couldn't. And the next day, I heard the gun go off. In the Tribune review, July 8th, there was 57 deaths by suicide last year in Westmoreland County. The coroner reported 60 suicides in 23, and nearly 79% of last year's suicides were men. Coroner Tim Carson said that as of July 1st, the county recorded 32 suicides this year and is on pace by year's end to be the highest number in a decade. This is where I wonder where my government is. For some time, I've attended many meetings that I've seen folks put on, and what I see from a lot of times the commissioners show up and take a picture and leave. So not only do I think that we need to put money where folks need it, I think we need to put recognition where folks need it. I see my community members working much harder than I think that they should to support the county, and the government not necessarily giving breadcrumbs. It's good that you respond and you say yes, but that's what you're supposed to do. You're supposed to serve these people. How long have we talked about mental health care in this county? What's really being done? And mental health care, there was funding pooled that was federal money that was then put into the school system because, once again, we weren't prepared. Every commissioner on this board has talked about, like Abby was talking about, weekends and nights. I don't want to work weekends and nights either. But maybe if you guys would, maybe my friend would still be here. That's all.
Is there anyone else here for public comment? Seeing there's no one else here for public comment, we will move on to the agenda for this morning. The first items for approval are